Greetings. I am going to be talking about my advanced organizer that I put together about teaching medical students about precipitating and predisposing risk factors for delirium. See, one of the things I really struggle with is how to teach the difference between predisposing or instigating factors that cause a delirium or an acute confusion in an elderly person in the hospital and the precipitating cause. And so I decided to create a advanced organizer based on the fact that giant pythons eat incredibly large animals. Like here we see a giant python eating a kangaroo, but sometimes it doesn't go well and the giant python actually explodes. And so here we see the outline of the snake, the giant python taken in the photo taken in the Everglades. And here we see actually a alligator's tail and rear legs that has exploded out of the snake. Now, how did this come to happen, where a giant python was exploded by a crocodile? Well, it happened because of both predisposing and precipitating risk factors. So we talk about some predisposing risk factors for python explosion, which include being really hungry, being a cocky young python, and having a history of prior snake explosion, because a very hungry python might eat things that it maybe shouldn't, like being cocky, it thinks it can get its mouth around something that it shouldn't eat, and as with all medical examples, a past history is always a predisposing risk for a second event. So a history of ectopic pregnancy is one of the largest risk factors for subsequent ectopic pregnancies, etc. So we'll use this python explosion to then discuss about actually the precipitating risk factors. So a really hungry, cocky, young python eats something really big, and that's actually what precipitates the explosion. It eats something that's still moving, again, like an alligator, precipitating explosion, and it eats something really with sharp edges. And so the analogy here that I will point out to the students is that it's very hard to change the risk factors, or the predisposing risk factors for python explosion. These are fairly intrinsic and unmodifiable. However, the precipitating risk factors, eating something large, eating something moving, and with sharp edges, is something that can be changed. And it's these precipitating risk factors that we're really going to target. So for delirium or acute confusion, what are the predisposing risk factors? Well, advanced age, dementia, impairment of activities of daily living, which is how a patient is able to care for himself or herself, as well as high medical corbidities. What are the precipitating risk factors for delirium? Well, that's really eating the alligator that causes the snake to explode, or in the case of the example we're talking about, causes the older adult to get confused in the hospital. And this is used of a well oft quoted mnemonic called I Watch Death, which runs through infection, withdrawal, acute metabolic derangements, trauma, CNS pathology, hypoxia, deficiencies of B12, endocrinopathies, acute vascular injury, toxins, and heavy metals. I hope that this description was helpful in talking through how an advanced organizer in teaching medical students about precipitating and predisposing risk factors for delirium can be used at the expense of the giant python, who is sometimes known to explode. Thanks.